Hi, my name is Rebecca Deerdorf. This is my patient Alyssa, and today I'm going to be doing a cardiovascular exam on her. So I'm going to just start by looking at her neck. So if you don't care, just turn your head to the left for me. I'm going to inspect for jugular vein distension and if she has any carotid pulsations. So just based off looking, I don't see any distension or pulsations. Next, we are going to measure her JVP. So we're going to start and we're going to put the tape measure at the sternal level. We're going to take another straight object, place it at a right degree, which looks about 7 centimeters, which is normal finding. We're going to palpate Alyssa's neck and we're going to check her carotid pulse, make sure we don't feel any thrills or anything like that. So we'll start one side at a time. Her pulse is just +2. It's not bounding or thready. Feels completely normal on both sides. Okay, next we're gonna note the point of maximal impulse. So it should be right under like the bra strap area, the 5th intercostal space, mid-clavicular. So I'm just gonna feel around and just note the presence of it. Perfect. After noting the point of maximal impulse, we're just gonna palpate. So with one finger, I'm just gonna feel back there. And it feels normal. And moving on, we're gonna palpate at the left sternal border between the 3rd and 5th inner spaces to assess for the systolic impulse of the right ventricle. So let's take a look here, move down between the 3rd, 4th, and 5th intercostal spaces. And now we're going to palpate the aortic area, which is like the 2nd inner space, to assess for the aortic arch, see if there's any pulsations there. So we'll come down to the 2nd inner space. I'm not feeling any pulsations. Okay, so if the PMI is not palpable, you're going to want to percuss. So we would start at the left border, which Alyssa's was palpable, but still we're gonna palpate or percuss anyway until you feel the dullness, which is right about there. Okay, moving on to auscultation, we're gonna take a listen to Alyssa's aortic and pulmonic areas, and then we're gonna move down her left sternal border and end up at the apex. So I'm just gonna take a listen to you. Everything sounds good there. I don't hear the presence of a murmur. I'm only hearing the S1 and S2. All right, since Alyssa is gonna need a complete cardiac exam, we rolled her onto the left side, and using the apex or using the bell, we're gonna listen to her apex and just make sure we don't hear any S3, S4, or a murmur. So we'll take a listen really quick. I don't hear any abnormal sounds. Okay, continuing our auscultation portion of her assessment, I'm gonna have her lean forward and I'm gonna listen to her while she's exhaling. I'm gonna listen for any aortic murmurs. Yep, you're already leaning forward, so just take a deep breath and exhale for me. I'm just gonna take a listen to you. I don't hear a murmur there. All right, after completing Alyssa's cardiac assessment, her heart rate, heart rhythm were normal. She didn't have any extra sounds such as S3 or S4. I didn't hear a murmur. Her timing and intensity were also both normal, and her split was the exact same on inspiration and expiration.